Hello everyone and welcome to my grand round presentation. My name is Alex and I am one of the newly hired MSN clinical nursing leaders here, and I am so excited to get to meet you all. The hospital leadership wants to achieve a magnet status, and to accomplish this, the number of MSN nurses needs to be increased by 10% over the next 5 years. This presentation is for nurses who are interested in achieving an MSN level of education. The objective of this presentation is to share with you my personal experience of graduate school. I also want to share with you about how graduate school has shaped me into the kind of nurse I am today. Graduate school was a great experience for me, and I encourage others to take the same step and pursue an NSM degree. Today we are going to be discussing a real-life case where my NSN education prevented a near miss with a patient. One patient scenario that I have experienced in real life is a 62-year-old male who is receiving chemotherapy for prostate cancer. This patient presented to the emergency department where I was working. After we completed some blood work, history, and vital signs, we discovered that he had a mild fever, low white blood cell count, tachycardia, tachypnea, and hypotension. When looking at the thought process of an MSN versus BSN nurse for this case study, we can examine key differences that I will be discussing here in this presentation. Nursing involves both art and science, which combine into one term called the nursing practice. The art of nursing focuses on the humanistic side of nursing. The art of nursing is rooted in the interpersonal relationship between the patient and the nurse. The art of nursing emphasizes the importance of a therapeutic relationship between the two, while emphasizing communication and empathy. The art behind nursing is all about the connection and support that the patient and nurse receive from each other. The science of nursing involves the knowledge and evidence-based research nurses use to guide their clinical judgment skills. The science of nursing follows the standard scientific investigative process and uses research to guide practices. The science of nursing uses nursing assessment, diagnosis, interventions, and evaluation. Research and innovation are key factors in this part of nursing, which provides a foundation for nurses to use when making clinical decisions. As a BSN, I have a strong foundation in assessment and evidence-based interventions. I was taught how to identify basic signs of health deterioration to implement life-saving protocols. In this case, as a BSN nurse, I would be able to identify that the patient is a neutropenic febrile patient. I would know how to monitor vital signs and administer basic medications as ordered by the provider. Some medications might include Tylenol or broad-spectrum antibiotics. BSN nurses focus their clinical judgment on immediate patient care needs and use already set-in-place protocols to guide their nursing practices. The perspectives between the BSN and MSN nurses differ due to the advanced theoretical knowledge that MSN nurses are educated on. In this case, the BSN nurse should be able to identify that this is a serious scenario and they need to recognize that help from the provider is warranted. Nurses with an MSN level of knowledge are better prepared to take care of more complex patients by bringing a deeper and more analytical lens. MSN nurses are taught about identifying subtle cues of a decline in health condition and how to quickly intervene. MSN nurses provide a comprehensive investigation of symptoms and previous medical history on their patient at hand. MSN nurses are taught advanced physiology, whereas BSN nurses only receive basic level physiology, making MSN nurses better equipped to notice subtle signs in patients. MSN nurses are also more knowledgeable about the complications associated with these complex disease conditions. So they would quickly start monitoring this patient for signs and symptoms of metabolic acidosis and septic shock. Multiple studies show that MSN nurses are better prepared for complex patient situations. These studies show that this advanced degree helps improve nurses' critical thinking skills in real-life situations. Studies have shown that MSN nurses show lower rates of adverse patient events occurring on the job. These studies have also shown that MSN nurses have higher patient satisfaction rates. MSN nurses are better equipped to handle and decipher complex clinical data, aiming to improve patient outcomes quickly. My MSN level of education has greatly impacted my nursing skills, and in this scenario, my skills were used to quickly make critical nursing decisions, quickly to identify early sepsis signs in my patient. This experience really shaped me personally in that I now believe that speaking up and advocating for your patient is a must, no matter what. However, before my MSN education, I only believed that speaking up had to be done only sometimes. But in reality, it always needs to be done. My MSN education has also allowed me to enjoy the challenge of treating complex patient health issues. Before, I would get anxious about having to treat patients with complex health histories, but now I have learned to love these challenges. I have come to realize that these challenges are what make me a better nurse overall. And here are my references. Thank you guys for listening, and I hope you enjoyed my presentation.